what happened to my dad was very inhumane.
Jose Guadalupe Ramos Solano was arrested by ICE on February 23rd and brought to a processing center in Adelanto, California. A month later, on March 25th, he was dead, becoming the 14th Mexican national to die in ICE custody or during enforcement operations during the second Trump administration.
Mr. Jose Guadalupe's case is not an isolated case, but rather a reflection of an alarming, unacceptable trend.
Ramos Solano had been living in the United States for more than 28 years, according to the Mexican consulate, and had a wife and 2 children who are U.S. citizens. ICE says that Ramos Solano entered the country illegally and had previously been convicted of possession of a controlled substance and theft. But attorneys who represent Ramos Solano are pushing back, claiming he was never convicted and would have had all charges dropped in August if he complied with a diversion program. They also say federal agents detained him while he was leaving his latest court check-in. According to officials, the 52-year-old Ramos Solano had several health issues, including diabetes, identified in a medical screen upon arrival at the ICE facility. ICE claims, quote, he received constant medical care while he was in custody, including daily medication to treat his illness. But no cause of death has been provided.
I think my family and I deserve to know the truth of what happened to my dad.
Ramos Solano is the latest migrant to die during Trump's second term. As of April 1st, 45 people have died in federal custody since Trump's return to the White House. 2 of those fatalities were victims of a shooting at a detention facility last September. The increase in deaths has coincided with a staggering rise in federal immigration detention, with the number of people held recently climbing to a record 70,000, the highest level in the agency's 23-year history. According to an ABC News analysis of immigration and customs enforcement data, the first 14 months of Trump's second term have been the deadliest period at federal detention centers since the coronavirus pandemic contributed to detention deaths. ABC's analysis found the death rate per 100,000 admissions currently at 11, compared to 7 last year and just 1 per 100,000 in 2022.
Too often, detention centers have had very limited staff, physician assistants, or just not proper medical teams. What I am seeing is that probably because of the growing numbers of people in detention, that problem is much worse.
The announcement of Ramos Solano's death came on the heels of new details about the death of Emmanuel Damas, a Haitian immigrant who died in ICE custody in early March.
Emmanuel was a loving man. He cares deeply about his 2 sons, and he's a people's person.
Emmanuel's brother, Pressner Nelson, last spoke to his brother on February 16th, when he says his brother complained of a toothache he'd had for weeks. He said Emmanuel had been denied requests to see a dentist, and that the tooth pain was more pronounced in a call with his mother 2 days later.
Wednesday, the 18th, he had called, but he could not really talk. It was really hard for him to express himself.
According to ICE, Damas was taken, quote, immediately to a hospital the next day after reporting shortness of breath, before being transferred to an intensive care unit at a hospital in Phoenix. By February 20th, Damas was intubated. On February 25th, Damas was transferred to another hospital, and the family says it would be another 3 days before they were told they could visit him. On March 2nd, Damas was pronounced dead.
He asked for help for 2 weeks. They said that he was faking. He was not serious.
In a statement, ICE says Damas refused tooth extraction on at least 2 occasions and had claimed his toothache had gone away, adding that, quote, it is a long-standing practice to provide comprehensive medical care from the moment an individual enters ICE custody. This includes medical, dental, and mental health services, access to medical appointments, and 24-hour emergency care.
We are in 2026. This is not 18 or 1700, where a toothache can kill someone.